Welcome to Goal Getter, the AAP Physiotherapy Podcast. My name is Jen Panteluk, and I'm the CEO of the Alberta Association of Physiotherapy. This show explores the power of physiotherapy, helping individuals move, heal, and thrive. Let's get moving. Today, we're joined by a very special guest, Stacey Will, an experienced physiotherapist who's going to talk to us about all things hand and wrist. Stacey, welcome to the podcast.
Thank you for having me.
So, to start us off a bit, could you give us a little bit of information about your background and your passion for working with hand and wrist conditions?
I'd be happy to. I have been working for a very long time. I've been practicing as a physio for over 30 years. I was fortunate in that when I did it, it was a bachelor program, so I didn't have to do a master's. When I was learning anatomy as an undergrad, I would have never considered doing hands because it was way too complicated, very hard to learn for exams. And if you had told me then I would one day specialize in hands, I would have adamantly refused. It kept sneaking across my radar as I started to practice. I have had a really fortunate career. I've had a lot of great work experiences. I started in as a rotating physio at the Rocky View General Hospital, so I worked in different services. I happened to get extra rotations in the hands plastics at that time. And from there, I went to private practice in a downtown clinic in Calgary, worked there for a few years. One of the clinic owners there, Jerry Bellows, really encouraged us to kind of find a niche as young therapists. Ironically, at that clinic, we treated a lot of feet. So what I did learn is I did not like treating feet. So I think I started to jettison a little further away, going through my orthopedic levels. And at that time, certified hand therapy exam was a very new thing in Canada. There was just one other therapist in Calgary, Myra Westaway. And I started learning about that and kind of piqued my interest. And I was fortunate to get a job at the Foothills Hospital Hand Clinic, which now is the Sheldon Schumer Community Accessible Rehab Program. And that's when I sort of fell into it, was treating only hands and really found my passion. From there, went back to private practice as I started a family. And it was at that time, this is over 20 years ago, a very new thing. There were not any hand therapists doing private practice other than myself and Myra Westaway. And it took a long time to grow. And even now, it's relatively unknown. There's still a lot of people that don't realize that there are therapists that just do hands. But with Google and patients being really aware of things, it is really growing and taking off. And it's really exciting for me to see more and more people be interested in it. Um, I had the opportunity, I worked at a LifeMark clinic for over 20 years doing hands and building my practice, and then was approached by a new clinic that had a lot of sport medicine doctors. And it seemed like a great opportunity for me to continue my career growth. So that's where I'm at now. What's been great about this place is it's allowed me a more chance to mentor. So I have had the opportunity to mentor a few other therapists. So our clinic now there's four of us doing hands. We're continuing to grow and allowing for that networking and more people to get experience in working with wrists and hands on a regular basis.
That's fantastic. And I love the opportunity for you to bring other therapists along in this area, especially if it is so unknown in like the bigger picture of physiotherapy.
That's kind of more become my passion now. As much as I spend so much time treating, I'm actually shifting more into a manager role now. And as I've grown, I've always wanted the opportunity to teach and mentor. And it's great now having an opportunity to work in a place where I get to do that a bit more as my job. And not just hand therapists, but all therapists. And so that's why I'm really grateful also for this opportunity and just getting more knowledge out there about the fact that it exists. It's not a matter of promoting the specialty, but just letting patients and therapists know that, yeah, there are some intricacies and it gets really overlooked, not just in our profession, but in medicine as well. Had a conversation actually just yesterday with one of our sprint med docs, one of our physios at work, talking about treating hands. And the sport med doctor said how when they're in school too, it's kind of overlooked. And it's the same in physio. You kind of get to the hand and here's the anatomy, and it kind of gets shoved to the side a little bit. And it's not intentional. I think it's just there are so many other things to focus on that are generally in medicine a bit more commonly seen. But same with medicine. And so he said that until he came to work with us, he had no idea there were therapists that see a lot of hands, or even some of the surgeries that we'll maybe later talk about that surgeons see, where I think our plan today is to chat a little bit more about thumb away, and that's a really great example of that. So it's just bringing that awareness that it doesn't have to be a hand specialist per se, but that there are people out there that can give you more resources and kind of uh, educate you on how to treat these cases.
So on that note, you said, well, there's not a lot of awareness around hands, maybe how to treat them, the fact that you can get help treating them.
Yeah.
Why do you think there are so many myths and misunderstandings about hand and wrist injuries?
I think one of the myths is that for a lot of times the treatment was always thought of just something that happened in a hospital. The context of hand injuries was simply something very traumatic. So you saw a hand surgeon, you went for plastics for custom splinting, and that is all that hand treatment was. So first of all, the fact that there is more readily accessible treatment in the community, and really any hand injury, even a minor one, is of note. It doesn't have to be something really traumatic. So that's one of them. I think the biggest thing is that the anatomy is just so complex in the hand. There are so many parts to it. So it is truly intimidating if you're not seeing it on a regular basis to recognize all these small little injuries. That is one of the big ones. The final misunderstanding is just it tends to be overlooked and minimized. Arthritis. Well, my grandma had arthritis, so I have arthritis, so we just have to live with it. Grandma never did anything about her hands. Grandpa's hands were all gnarled and off to the side, and he still worked in the farm. So it kind of gets brushed off. Wrist sprains would be another example. Fall, sprain your wrist. Generally, it's just like, oh, it's just a sprain. It'll be fine. And this really struck me. I was on a conference in Vancouver this fall. It was the American Society of Hand Surgeons. And I was sitting in a talk with another young hand therapist about these wrist surgeries that they do, or surgeries that they do for acute wrist sprains. And she had sort of asked me, you know, in the States, maybe do people go get these surgeries more often, or why aren't we seeing these? And the thing with surgeries for wrist sprains, and this is a really traumatic acute wrist sprain, for the surgery to be successful, you really have to catch them early. Like you have to sort of see them in those first couple of weeks. Similar, and I'm stepping a little bit outside of my box, but with knee surgeries, ACLs, right? They are more successful if we're catching them early. So I think we're not seeing them as often here, not because we're not doing them. We just don't catch them early. There's, I think, more recognition in the public of, oh, I think I sprained my knee. It's swollen. I had better get medical attention right away and get this in front of us. Whereas if you fall and sprain your wrist, ah, it's a sprain. It'll be fine. Like there's a little bit of a cultural change in that. And so the wrist sprains we tend to see, they're 3 months out because they've been living with them and pushing through them and then coming to see us with this painful wrist that's not functioning, but now it's not acute anymore. So that's, again, I think one of the sort of myths is just how we view these injuries. We
Mhm.
generally really tend to minimize wrist and hand injuries. Final one example would be I see a lot is finger injuries. Even just going to the emerge that people will dislocate their finger and they'll go to emerge and they'll take an x-ray and you dislocated a finger. And then you're kind of sent off and just be like, yeah, just, squeeze a ball and off you go. And
Fine.
I again, it's my specialty, and so I have a bias against this, but it sort of baffles me. We wouldn't see someone who dislocated their shoulder being told to go home and just start getting it going and moving again. It's actually the same injury. It's the same level of trauma and ligament damage to that joint. But because it's just a finger, it's okay. We'll just throw a little popsicle stick on it and off you go. And again, we see these patients months later with this swollen joint wondering why it's not improving, even though they're trying to move it as much as they can. So it's again, it's just sort of an education and a perception thing about how to manage these.
Are there other myths around treatment that you really think should be put out there and people should have a better understanding when it comes to those hand and wrist injuries?
Yeah, there's a couple things, especially when we start treating these. One of the biggest ones that we see, especially with finger injuries, is there's this preconception. I hear this from physios as well that they'll refer the patient to me or doctors. We've got this finger sprain and it's been 2 months and it's not healing. So it's almost this inception that finger injuries or hand injuries take longer to heal. And it really doesn't. I often sort of spin it and go back to our stages of healing that a bad finger sprain could be a second or third degree sprain. I mean, anywhere else, we would expect that to take at least 3 months. First problem with fingers is that it takes 3 months, assuming great conditions. So that's, if you sprain your ankle and you're resting it, maybe you're on crutches and you're wearing a brace, it's going to heal a little faster. Whereas if you've second or third degree sprain of your finger and you're trying to move it as much as possible, that already is going to put us back a little bit. It's not going to cause a reversible damage, but it can just delay the healing a bit. The other part is the complexity of the anatomy. There is a lot of structures packed. So in a finger, in a tiny little space. And if you think like that finger joint, it's joint, ligaments, tendons, skin, not a lot of space in between. And so if there's a little bit of swelling on any of those structures, it's actually a lot more visible than a little bit of swelling in your knee and that residual. And it's also very in front of you, like you're looking at your finger all the time. So that residual swelling that persists, and these can be swollen for 6 months or more. Very normal.
Oh, wow.
I would argue that would be the same in any joint, but it's just so in your face that it seems that it's taking longer. So our expectations seem to be a little higher. Um, and again, the complexity, there's a lot of structures that have to move through that. If one joint is a little bit stiff, it impacts all the other joints. So that's one of the tricks with treating hands. The other little myth I just wanted to quickly address is, and I seem to hear this more with hands, is there this confusion between fracture versus broken, that people will come and see me and they've had an x-ray. They'll be like, yeah, but my thumb is just fractured. It's actually the same thing. I think there's sometimes a perception that the term fracture is less serious or like a tiny crack versus a break. But from medical terminology, a fracture is a break and it can be a complex fracture. It can be quite serious. So sometimes they'll be told that they fractured something, but they think it's really simple, or a wrist, oh, it's just a fractured wrist. That's a broken wrist. It's actually quite significant and it needs to be casted and taken care of and taken through its treatment. So it's that's just another one I wanted to throw out there because we sometimes see that a little bit and people are really shocked when I show them their x-ray or talk about the break. They're like, oh, I thought it was just a little crack. So just a little education piece. Thank you.
Oh, that's really interesting. I, to me, fracture sounds just as bad as a break, but good to know that some people don't take it as seriously.
Yeah, I'm not, colloquialisms, I'm not really sure. Every once in a while,
Yeah.
yeah, I had one recently that was actually a friend. It was the tip of her thumb. It was broke right through, and she knew it was broken. Like there was, the way it was described, but it's something that's I'm lucky that I work in a place where I can access the X-ray images, and so
Mhm.
it is really interesting when you see the describe of like a crack or a break, but then to see it sometimes carries a little bit more weight. So.
Makes it more real.
Yeah. Yeah, and also sometimes can affect how we treat it. You see it described in a report as a crack, and it's not incorrect. I mean, at the radiology, the report is correct, but it's when you see it, and maybe is there a little bit of displacement, or where is that, and is it borderline unstable? Is the difference between do we need to splint it for longer, or do we want to get it moving a little bit? I suppose that might be a little bit of my plug for helping physios having access to look at X-ray images.
Yes, I think so
It's
importantly.
very
How do you treat if you're not sure exactly what's going on under the skin?
I honestly couldn't do my job without it. I mean, part of it is that I'm used to it, and again, working in a place where we have that access, working with sports physicians, but it makes a significant difference. It really does. Even in the cases of arthritis, sometimes mild arthritis, they'll say, "Oh, like the X-ray is clear," but I'm sitting with the patient and I know where they're sore, and seeing a lot of hand X-rays, you can just see that it's just that little bit different, and it's not that I'm disagreeing with the radiology report at all. I mean, they are doing their job great, but because I've got the patient in front of me, that maybe little bit of off stepping or that is applicable to what they're complaining of and kind of just helps me educate the patient in what we're treating. So,
Right. It gives them that customized treatment to help them
yep,
with whatever it is they're trying to manage. And
yeah, yeah. I This is something we'll chat a lot about today, but patients today, I think, with people are more and more educated in general, whether it's
yeah.
Google or talking to people in that, and the biggest change I've noticed in my many years of practicing in how I treat is how much more time I spend now educating patients. Um, it it's not that it wasn't a thing when we first graduated, we educated patients, but
Mhm.
now like I can have sessions where that's the whole visit. And that's the biggest piece to a patient's recovery is understanding their diagnosis and what's happening and what the timelines are going to be and what can they be doing or shouldn't they be doing? What's an adjunct? Do we need to pull in other medical assistance? Do we need to pull in other diagnostic imaging? And it's just that having that time to answer those questions and work through it, especially when there's maybe a bit more complex history. It's not a trauma, it's something that's been coming on over time. So anything we can do to help with that education understanding, patients really appreciate.
Absolutely, and making sure they have access to, like, credible information and education. Because your point about
Yes.
Google, right, like, how many times does a patient come in and they're
Yeah.
like, "Okay, I think this is what's wrong with me. I've Googled it. I'm probably having to do this next."
Yeah.
And sometimes it's
Yeah.
kind of reversing some of what they find when they're not sure how to access, like, that credible, evidence-based information.
Very much so. And even kind of going back to radiology reports, and I mean, you'll hear the same thing in relation to anything else, knees, backs, low discs, that sort of thing. That a lot of times, if a patient goes to their family practitioner and they've got pain, and again, as I mentioned, family practitioners, I mean, GPs, that the scope of what they treat is massive. They have to look at so many parts of the human body. They can't keep up with all the nuances of little wrist diagnoses, right? So their tool might be to send them off for imaging. So a lot of times, and this I know is in working with wrist surgeons, something they see a lot. That unfortunately does contribute to wait lists is where, okay, you have wrist pain. So you go for an MRI, you get your MRI. It shows that you've got a tear in your TFCC. That's a really common one, ulnar-sided wrist pain. And patients will come with their MRI. They have a tear, but they have no symptoms, right? Like whatever symptom they had that brought them to the doctor has since resolved. It's minor. Yes, there's a tear, but it's that one of the surgeons mentored me and I worked with for many, many years, Dr. Bowen, he was really emphatic about we don't treat imaging reports. They are an important piece, but they should be used to kind of support and confirm our diagnosis, not make our diagnosis. So it's just, we're always sort of looking at all those pieces of the puzzle, but
Mhm.
that thing on the paper doesn't mean that you need to be sent to a surgeon right away necessarily, right? There's a disclaimer, there's always exceptions to everything, but that's again where it's confusing for the patient because they can access the reports, they can see they have a tear. What does that mean? Is it clinically relevant? Is it something we need to worry about? TFCC tears, I think I read a study once that over 70% of us are running around with them. Does that mean we have to fix them? Not necessarily. I've taken us way off
Right.
script.
No, this is fantastic, and I think it's
That's
just
what I do.
but it goes to show just how much information there is out there that needs
Yeah.
to be shared around
Yeah.
this
Yeah.
small but mighty body part. It's something you use on a daily basis, right? Hands
Yes.
and
Yeah.
wrists,
Yeah.
everything you do. And for some people, it's their livelihood. So I think really understanding what's happening in this
Yeah.
particular piece of the body is very important.
I'm for almost everybody, it's their livelihood. Gonna argue that point.
There you
I
go. Yeah.
early in my hand therapy career, I remember this one lady, and she had significant Raynaud's, significant issues with her hands, like quite debilitating. And she was the funniest lady. She worked as a lab tech, very, very hands. And we would joke about what job she could have where she didn't need her hands. And our one we had was air traffic controller. As long as we could like strap a couple cones to her, she could do this.
Right.
Um, the other one's maybe a little offside, but phone operator for different professions. You could be on the phone for different things. That was about it. That's
Right.
pretty much all we came up with at that time. That was 20 years ago, but yeah.
Yeah.
So but no, impacts people quite significantly. And I think most patients I see, they'll often say that they didn't realize how important a little finger was or their hand was or a thumb, right? Until you injure it. Like my friend who recently injured her thumb, she's like, yeah, I'm reminding why opposable thumbs are such a big evolutionary thing. She was really missing hers.
Yeah,
Um,
absolutely. So we've talked a little bit about types of
yes.
injuries. There's often confusion between an acute injury and a repetitive strain injury. How do you help
Yes.
people understand the difference?
Um, Generally, an acute injury is a result of a specific trauma. So those ones are kind of easy to separate. Again, there's always little nuances and exceptions, but generally, there's in a specific incidence or a trauma in the hand is often a fall, hyperextension of force, catching it on something. You can also have traumas like a cut, a crush injury. A crush injury is big with hands. Hands get stuck in places they shouldn't get stuck in. torque, anything that's sort of it's an incident and it's causing immediate pain. There can often be swelling and bruising. Hands are a bit funny, especially wrists, that they don't always puff up like swollen ankles do. So I say that often, but it's not alone a necessary criteria. But it's something where you like, okay, I did something and yeah, something happened and it's sore. That would be an acute injury. Often it can be something has been damaged, fracture, a bone has been injured, a ligament, a tendon, any of those structures. Whereas a repetitive strain injury is something that is usually a little bit more ongoing, gradual onset that's coming on. Often can be a result of a repeated pattern. It's causing repeated strain on a structure. So our onset is sometimes a little more gradual that we're not quite sure when it happened. Sometimes it can be a little out of nowhere. Like I've had patients where they woke up with something, but they can't really remember what they did.
Mm.
The human body is amazing. It really has amazing capacity for tolerance to repeated strains, right? That you could be, reaching and straining something. You don't know it until just that final structure that maybe, in the summer that patients will be tons of raking and they'll do lots of garden work and that totally seems fine. But then they go to bed and they sleep on their hand all scrunched up and they wake up the next morning with pain. Uh, it wasn't the sleeping that wasn't a trauma. It was kind of a final straw of those repeated incidents prior to that. So these ones tend to be sometimes a little bit more complex to diagnose. There's many layers to it. And the wrist, another example we'll see is patients come in and they're struggling doing push-ups or you might be pushing out of their chair versus or doing yoga. That's one we see a lot with wrist pain. It's not an acute injury. It's something that's come on gradually. But because there are so many parts to the wrist and the hand, it's often compensatory that over time, certain structures are having to work a little harder than others. And it does often catch up with us. Not all the time, but often it does. So that's the best way I could describe the two of them.
No, that's excellent. And so you're saying sometimes it's hard to tell or hard to diagnose. So when
Mhm.
it comes to that physiotherapist, and you said hands are something sometimes people are shy away from because they
Yeah.
just don't have that same level of education. If they're presenting similar when it comes to symptoms,
Mhm.
are there different tips or some words of advice you might have for physiotherapists on how they can like differentiate between a sprain or a fracture and something repetitive versus acute?
Yeah, absolutely. I think one an example I think I'd like to use because it's kind of a good one to talk about is with wrists, especially in radial side of the wrist, scaphoid type injuries. Because when we look at wrist injuries, we can look into ulnar sided TFCC issues, and that's one whole box. But the radial side would be a good way to talk about your question. Um, Again, as a disclaimer, it's kind of a basic overview. There's lots of nuances, but these are just a couple of things I would keep in mind. Um, First of all, it can be misleading, even with traumas. Kids in particular, they're tough. I'll often see these, and kids and young teens who have had an injury and they've fallen and they've got pain, but they have full range of motion. So one of the kind of things to keep in mind as a practitioner is just because they have great range of motion doesn't exclude an injury. It sometimes surprises me how, especially with young people, they can have a break or an injury and they still have really good range of motion. So we look at the range of motion, but we keep that in mind. Having said that, if you have someone coming in and they've had a trauma and they have very limited range of motion, okay, well, obviously we're going to probably try and fast track that a little bit more for some imaging and look at it a little bit deeper. So that's the first one. Other thing, again, I said swelling can also be deceiving. That let's not rule out the potential of a scaphoid injury, a fracture, or some trauma just because there isn't a lot of swelling in the wrist. There sometimes isn't. It's sometimes very, very minimal. Pain as well. Sometimes with significant fractures, obviously have pain, but we'll sometimes see these young athletes, teens, even adults, where it doesn't hurt all the time, but it just hurts with really specific things. So, how do we know? The history with physiotherapy, again, it's about the history, is really was there a trauma? When did it happen? Talking to them about movement patterns. Does it hurt at night? Does it hurt with different things? Is it only with specific activities? To try and start put together a bit of a clinical picture of what's going on. Um, Looking at imaging, requesting an X-ray if there was a trauma, if there's pain with even end range movement, kids especially, I tend to send for X-rays a little bit. That's always something like if you've seen someone who's had a fall or trauma and they haven't had an X-ray, and you're even wondering a little bit, "Gee, should we get an X-ray?" You probably should. It's low cost to the system. It's very low risk, right? I think we've all heard the studies now that really we're exposed to more X-ray going through the airport than we are going for our X-rays now. So it's very, very low risk. It really is something that if there's been a fall trauma, should probably cleared. I am going to talk a little bit more about that with scaphoids in a second, though. And then the other things to look at is where are they tender. So if I'm want to speak a little bit more about radial sided wrist injuries, if there's any pain in the what we call the radial side of the wrist, so base of the thumb, there's an area that's called the anatomical snuff box, and it's this sort of little pocket at the base of your thumb where it joins the wrist, and that's where the scaphoid sits. So if you've got someone where there's any tenderness in that area, in that snuff box area, but also base of the thumb, top of the wrist, central part of the wrist, you always want to kind of be thinking, okay, potential scaphoid fracture or sprain until you've ruled it out otherwise. It's always good to have that in your brain and clear those hurdles first. The nice thing about I don't know what it is. Let's say, is it a break? Is it a sprain? Is it maybe just a mild sprain? What I often mentor my fellow therapists is that we treat it the same way regardless. If it's a new injury, let's allow it to rest because sometimes that in itself can be diagnostic. Get it in a wrist brace. Put the new injury, put it in a wrist brace for a couple weeks, pull back from activity. It's always safe to give a little bit of gentle range of motion without load, no passive stuff. And how do they respond to that? If you put them in a brace for a couple weeks and they come back and they have zero pain and no symptoms, okay, we're a little less worried, but that it's always a good place to start while you're sort of still maybe do you need to refer them on to someone else and checking off those boxes and getting the patient on the right set. Um, with scaphoids, we're talking about with fractures, they're really complex bones and they're really hard to see initially. So sometimes you might have somebody who has scaphoid area pain and they've been x-rayed once. That's not enough to clear it. Typically with scaphoids, they sometimes don't even show, fractures don't show in the first couple of weeks on x-rays. So we often will repeat a second time to start to see, okay, the lucency of the line can be a little bit more obvious later on. So if I sort of teach at our clinic, you never trust a scaphoid. Like, honestly, I like to clear it at least twice with x ray, and same with the sports med docs we work with. We're looking at clearing it a couple times. If there's persistent problems, we're further following up with it that they might be sent for a spec CT scan or other tests just to make sure, especially in that younger population, that we are not missing anything.
And is it because of where it sits on your hand that it's, like, so notorious to miss a fracture in that area?
The missing is more the shape and the little lines that they see. So they can have these
Okay.
subtle little lines that when it first happens that they kind of hide because it often too can look mild. Problem with a scaphoid is it's a bit of a design flaw. It only has blood flow from one end of it. So the majority of the blood comes in one end. So if there's a crack through the middle, the other end won't get its blood flow. So that's why it's super, super important that we catch them because of that. Because with that, if there is a crack, they sometimes will not heal depending on where the break is. Um, but they also can hide a lot. So sometimes they become a little bit more obvious later. I mean, in a bad situation, they become more obvious when you've missed them and now they're not together. But sometimes we see them because as the body starts to heal, you get that little callus formation. So it's more of a white line. So it's easier to see on the x ray. But still, then we know, okay, there was a fracture. Yeah, maybe it's healing, which is fantastic. But we really want to optimize conditions and make sure that those injuries heal really well.
So what happens if, like you said, this is something that's sometimes tricky to diagnose? And so if a scaphoid fracture or a significant wrist injury goes undiagnosed, what are some of those, like, the risk to that individual patient?
Yeah, It has to do with, again, with the blood flow that they go on to not heal. So in worst case scenarios, if you have one that was completely missed and wasn't repaired, and we'll sometimes see these patients now, in their 40s, 50s, because they weren't picked up, where they're coming in with quite arthritic bad wrists, because the that proximal carpal row, that first row where it's sort of the basis of all our functions, there's the scaphoid is a big piece of that. And there's ligaments that connect each of those little carpals that help give it that nice stable row from which the hand rests on. But there's if you have the scaphoid now in two pieces, there's no ligaments connecting that. So now it's almost like a separate bone, if you will. So it starts to drift across and other things can drop down. So that's your worst case scenario, what we're looking at for these ones that go on to what's called a non-union. Um, but backing up a little bit, if we can catch them a little sooner, even if they get missed initially, these scaphoid fractures can often be surgical. Now, this is again not a conversation for me. This is where we pull in wrist surgeons. Like for us, when we um, see these scaphoid fractures, and if we notice them, we're always sort of pulling in whether with sport medicine and depending, there's a lot of nuances to it. How much is it? But often just pulling in a surgical consult. How does it look? Is it something that they need to see? How are we monitoring it? We tend to cast them a lot longer because we want to make sure they're healing. And even if they are lined up well, then the second component of it is because the blood flow in that bone isn't great, is even if the pieces are together to start, do they actually heal? Sometimes, if they don't, they go in and they pin them together to enhance that healing. So it's just, and like anything else, if we catch it a little bit earlier, our
Mhm.
chances of it healing better are higher, right?
Right.
But they can be tricky ones.
And for those who may not be as well versed in anatomy, where
Yes.
exactly is this scaphoid?
Scaphoid is basically base your thumb. We sort of call it that first column. So if you kind of go down your thumb to where it meets the wrist, the scaphoid is sitting at the end of the radius, right in that little juncture. And that's what's allowing for a lot of our mobility forward and back, side to side. It contributes to your thumb mobility. It is in a shape where it also helps take a lot of load. So being able to do things like push and pull and, do some yoga poses. I mean, all parts of the hand are important, but it is that's first row scaphoid lunate triquetrum. They are very important where they articulate there. It's like a kidney
Perfect.
shaped bone, is what it is.
Interesting. One myth, and I think, as our population ages, is that
Mhm,
wrist fractures after the age of 40 are just a part of aging.
mhm.
Can you maybe unpack that a little bit and why that belief is so dangerous?
Yeah. Um, Actually, the conference I went to in Vancouver, the Hand American Society of Hand Surgeon conference, it was this massive conference. It was fascinating, but there were all these little talks you could kind of drift in and sit on. So I did sit on a couple about wrist fractures and osteoporosis. And the panel of surgeons, what they were really talking about is encouraging their colleagues to really treat these wrist fractures very seriously and especially as a screening tool, because the as we get older and if there is osteoporosis, that it's not so much the wrist fracture itself, but it could be a precursor. If there's osteoporosis that's undetected, can cause very significant injuries, and sometimes even with fatal consequences, like as you get older with hip fractures that are causing hospitalization. So what their push was with women who are having wrist fractures, postmenopausal, is just to make sure that they're being screened for osteoporosis. So there are things that can be done preventatively. So that's one big part of it, is, and doesn't mean that just because you're over 40 and you fall and break your wrist, you are osteoporotic. I don't think it's something we need to panic about. It's more
Mhm.
just being preventative, and just being aware of that. But the other part is that these wrist fracture, especially at the age of 40, they're usually very traumatic. They're big breaks. It sort of goes back to what I talked about, that myth of it's just a fracture. I think some of it, after treating so many patients, and often, especially treating my patients with these bad wrist fractures and being so frustrated with how long it takes, and their friends saying, "Why aren't you better yet? You just broke your wrist." I think it almost goes back to that culture thing, that our knowledge of a wrist fracture is little Johnny when you were 7 in playground and he fell and broke his wrist and he had a cast on for a month at school and it was really cool and he took it off and he was fine. And so that's almost how we picture wrist fractures, is like that. But That fracture at that age and a fracture of your wrist when you're over 40 and are just the shape and the hardness of our bones is different and the way they break with force is very different. That these fractures when we're older, sometimes they need surgery, sometimes they don't, but they often change the alignment of our wrist. That you can't snap the end of your radius, which is a big bone, and it often sort of snaps and shifts a little bit. Well, now it's shifted and it's changing the alignment of everything. And again, back to the anatomy. There are so many ligaments and tendons and in that area that they get a little bit swollen and you're casted for a long time. So wrist fractures, whether or not you need surgery after 40, it's at least a year recovery. And it doesn't mean that you're debilitated for a year, but it's a long process. And I think, and that's not just wrist fractures. I think I've listened to some other podcasts of some of my other great colleagues, and when we're treating a lot of these things, it's yes, you have the surgery and you have to be careful for 3 months, but your healing's never done at 3 months. Our body is constantly remodeling and changing and adapting. And so this healing does take a little longer. It doesn't when you're 7. When you're 7, you bounce back pretty quickly. But over the age of 40, it does have a much bigger impact. So it does need some help along the way.
Right. To be a kid again.
Yeah. Yeah. Well, and I think with kids' wrist fractures too, it's most times when kids break their wrist, it's actually what's called a green stick fracture. So it's not like a break, it's more that the bone kind of bends, right? So it's not perfect and it's a little off, but it's not like it's broken or cracked through. So their bones are softer, so they just heal
Right.
a little bit better. It's much less complicated. Generally, again, not all kids breaks are the
Generally.
same, but often in the wrist anyways, that's how they are.
Right. So once an injury is identified, let's talk
Mhm.
about how physiotherapy can support a safe and effective recovery.
Absolutely. As I sort of mentioned before, our main tool is education. This is the big thing that we do is almost like tour guides on this journey is really helping people along every step of the way. Depending on the injury stage of recovery, we're trying to guide them through where they're at in their recovery and what to expect there. Um, we're always referring back to stages of soft tissue healing, and whether it's a break in the bone or a sprain of ligaments or a tendon injury or crush injury involving all of those, everything sort of follows the same stages of tissue healing. In a perfect setting, it's sort of that 0 to 6 weeks, 6 to 12 weeks for things to start to scar together, scar to turn over to normal tissue and start to heal in. So that's in those early phases, and just encouraging that depending where they're at, that we're allowing that optimal healing to happen, whether it's by pulling them back a little bit, resting, often, pulling in braces or casts or splints or something to help with that. But then as they're coming out of that, moving into the more healing stage, is guiding them through getting back strength and proper movement. Um, Again, rest and protection is a really big part. And I think that's something within hands we tend to jump over a little bit. It's a fine balance. Hands do also tend to stiffen up. And I think often when people injure their fingers and they're told to get moving it right away, that's because medical professionals also know that fingers get stiff. And that's not wrong, but it's depending on the position. If they're in the first 2 weeks and they've just injured something, really pushing it and making it more swollen is not going to give you movement faster. Supporting it, bracing it, allowing that swelling to heal, allowing the recovery to start to happen, and then doing like really intentional, purposeful range of motion to get it going is the trick. The question is, when do you start that? That's the physiotherapist's job. Often that's what patients will say to me. They'll come and they'll list off all these things they're working on and what they want to do. And their question is, they're like, but I just don't know, like, you know, when I should start or when I should stop or what pain I should listen to. And I say to them, that's my job. That's what I'm here for, is to take the data you're giving me and where you're at in the ceiling and to kind of help guide you. Okay, yeah, we're okay to start this. Actually, that really flared you up. Let's pull back. Let's hold off for a week. Let's bring this other exercise in. So just guiding along that journey. Movement in the hand is really the key part. And again, when treating a hand, we're not just talking about one joint, um, multiple joints. I mean, if you fracture your wrist, but there's also the thumb and the fingers get stiff because the swelling just doesn't stay here. It hits the whole hand. So looking at getting everything moving and moving in a really good way. I mentioned compensatory patterns. Just because something moves doesn't mean maybe that we're moving it optimally just because we're using a hand. Often I'll give patients exercises and they'll say, well, yeah, but I was using my hand all day. But often you're using your hand in the movement you already have. And we want to optimize that and make sure we're getting all those joints moving properly. And that's something, again, with physio is sort of looking at movement patterns and I'm like, okay, fingers are moving well, but thumb's a little bit stiff. Just trying to pick those patterns out to help them continue with their progress. A good example of this is one of the really common exercises that people will give hand injuries is, well, yeah, your fingers are stiff, so just squeeze a ball. And that's my pet peeve. Squeezing a ball, in my opinion, is probably one of the most useless exercises that can be given for a hand. If it's the only thing a patient has and they haven't seen a physio, it is better than nothing, arguably. But the problem with just squeezing a ball is that it's kind of that same pattern, and your fingers actually aren't moving very far. Often I'll get rid of patients' balls and have them just work through range of motion specific to the fingers. Bucket of rice is one of my favorite therapy tools for hands because it's much more dynamic and you can get bigger range of motion, also a little bit of resistance. It's really soothing. And so those are sort of examples of just because you're moving something doesn't necessarily mean we're moving it in the most optimum way, and having somebody kind of guide you through that.
Well, I think that's what I love about, anytime I've had to go see a physiotherapist for whatever it is I'm working through. It's just that step by step and also the progress, right? I think that's one of the key pieces is a physiotherapist monitors, they see how you're progressing or how you're not, and then figure out, okay, what's that next step? So I think that's one of the beautiful things about when you're healing and recovering from any injury that has to do with movement.
Absolutely. And sometimes too, because sometimes the recovery is whether there's still pain, and pain is such a tricky thing. I mean, I know you've had Alex and people talk about pain as in its own, and that's a whole other talk. But
Mhm.
presence or absence of pain alone isn't always a sign of progress. Sometimes when I'll have patients come in and they'll say, like, oh, I was so much worse yesterday. I sometimes say to my patients, if they have a bad day, I actually get excited because often if they've had a day that was bad, it can mean that the day before they actually had a really good day and they did more. They maybe inadvertently, without even realizing it, maybe they used their hand a little bit more than they had since their surgery. And then they suffer for it the next day, right? And it doesn't mean that anything bad or horrible has happened. It's kind of like if you lay on the couch for a month and you get up and go for a walk, you're going to hurt a little bit. So, and that's again back to the role of the physiotherapist is that it's a lot to unpack for a patient, and that, it hurt more today. Is that a bad thing? Is that a good thing? And as we're listening to the patient and, knowing things of where are they on their journey, what is their injury, is there any structure that I don't want to be painful? I mean, if
Mhm.
I give them some exercises and are coming from a scaphoid injury, they're coming back and they've got pain in their scaphoid, that's a different conversation. But so again, we're sort of unpacking all that data and going back, well, no, actually sometimes hurt does not indicate harm. Sometimes that's okay. You're challenging, you're getting a little stronger. Maybe you stretched it a little bit. Maybe it was just sore at the end of the day because it was tired. Put your brace on. So it's, as physios, we're spending a lot of time kind of helping patients know where they're at in that journey because it can be very overwhelming for sure.
To prevent even getting to the place of injury,
Yeah.
do you have any specific strategies that you would recommend to prevent injuries in general population, young athletes, anyone who may
Yeah.
be at more of a risk for a wrist injury?
I mean, we're all, I think, potentially at risk for wrist injuries because people fall. Often patients come and they'll say, how do you prevent accidents? Or I want to return to skiing and I'm worried I might fall. I'm like, well, if you want to go back to skiing, you're probably going to fall. Like there are certain realities.
Mhm.
And if we're doing something we really love, we accept those risks. Often if I have a patient going back to skiing and they're worried about one wrist, I usually say to them, I'm like, you're probably much more likely to injure something else than that particular wrist. But so that always exists. But prevention in general, things like flexibility, especially young athletes as they're growing, and you know, my young hockey players, for example, they're hitting the gym, they're doing tons of strengthening. Stretching isn't very fun. And if they do stretch, they're really great. We're all really good about stretching our legs and, get out of a chair and stretching our back. We forget about our hands. I would sort of say to most people that when I'm treating them, teaching them wrist stretch, have you ever stretched your wrist? No. I mean, we just don't. And if you step back and think of how much our hands and wrists work during the course of the day, from the second you get up and you're washing your hair and brushing your teeth and chopping the vegetables and driving the car and picking up kids and carrying groceries, they're working all the time. So
Mhm.
incorporating a little bit of proper good technique stretching can really go a long way. It doesn't mean we have to be super bendy, but there should be balance. Typically, I'll see people with, either really great, they're really bendy one way, bending their wrists, but can barely extend their wrists. It would be the same as if you had really great knee flexion. You could bend your knee all the way, but you can only straighten it half the way. There needs to be balance on either side of a joint, because that joint should have that same arc of movement, flexors versus extensors, to prevent repetitive strain injury. Same with thumb, fingers, all of those sort of things. So that slight balance of flexibility can go a long way for preventing certain injuries. Um, and then just, I think, awareness of balance. Again, I alluded to gardening.
Mhm.
We live in a climate that it's nice today. I get all the raking done and all the weeding, and I'm gonna go, and then I'm cooking for my family, and that's a lot of work for a hand in one day. Sort of back to back. So trying to pace it out, and I always tell patients I'm the worst for this. That I get going, and there's another weed, and there's another weed, and I'm not going to stop. But having those forced breaks, that if you're out in the garden, been out for an hour, come back in, have a glass of water, just take a little bit of a break, mix up the activities, just something little, so you're not just doing that same activity over and over again. The same applies with work. For those who do sit at a keyboard all day, is just taking those little rest breaks. Uh, I often get asked about, what's the best ergonomic keyboard or mouse? And first of all, I can't keep up on that technology, but
Mhm.
I don't think there's any such thing. If you sat in the perfect ergonomic setup for 8 hours without moving, it's not good for you either. So best ergonomics is those little rest breaks. I think right now, where we have this culture with these big, massive water tankers that you don't have to leave your desk because you got your big mug,
You're set.
that's the worst thing for you. I say to patients, like, little cup of water, and every hour you get up, you go fill your cup of water, you take a little stretch break. If you're getting up and you're stretching out your back, think about moving your fingers, stretching your wrist. The other nice thing for my people who sit at a desk all day is if you're taking little drinks of water throughout the day, it's also going to force you to get up and go to the bathroom. So it just gives you that natural work break. So that balance and just breaking up your activity can really go a long way for preventing injury. Couple other little things. Uh, I often, especially with my athletes, people who are in the gym a lot, especially if they're recovering from an injury, I recommend wrist wraps. Weightlifters use them, where they wrap their wrist to lift heavy weights. If you're doing a lot of weightlifting, it's not a bad thing. Your wrist isn't moving around a lot anyways in the gym. So having that little bit of stability can actually be preventative of some of the types of injuries we see in the gym. Um, Another prevention thing, I think push-ups, yoga is fine and balance. I would recommend we avoid the funny TikTok challenges. There was one during around COVID time. It was a push-up challenge where people were doing entire workups in a handstand position. That was really good for business, because
Everyone was
I
coming in.
yeah, we can do push-ups and stuff like that, but our wrists and hands are not made for constant weight bearing. So doing entire workouts in a handstand, you might want to have a good physio in your back pocket if that's something you really want to do. That's all I'm going to say about that. And final thing is, just especially for our younger athletes, is not to ignore pain. That, I say with my young hockey players, that if you do fall or you hit something or you catch something and it's kind of sore and it's not going away after a few days. Again, my young kids, like, I've seen like hand fractures where they don't really notice them. Like, yeah, they do something, but it's like it's not until it's been for a week or two it's still kind of bugging them and they finally say something. It's just so much better to get it looked at earlier, because we don't want something to get missed that then can get worse and might require surgery. It's always a tough conversation with these young athletes, because yes, coming in to get it looked at might mean you're off for a little bit, but
Mhm.
sometimes it can be off for less of a period of time, as if it gets worse and then you're missing more games. I'm mom of two former, I had a competitive skater and a hockey player, and I know it's really there's never a good time, right? There's always a tournament
Yeah.
you're going to miss, and it's always terrible, but your hands, and we need to look after them. So if there is something going on, better to get it looked at right away. Often maybe it's just nothing and we can clear it, but just to kind of get the proper treatment in place to make sure that it doesn't become something more serious where you're missing more time. And I have seen a few high level hockey players where they injured something, it was diagnosed as a sprain, they kept playing through it, and it was a missed scaphoid, and then they were off for 6 months. So those ones in particular, and that's again at higher levels where they just
Yeah.
kind of getting pushed through a little bit. So always just advocating and double checking things.
So then your recommendation would be if someone suspects something's not feeling quite right in your hand or your
Yeah.
wrist, get it looked at just to make sure and rule out
Yeah,
that anything more serious.
exactly. I mean, if there was a incident and, after a day or two, definitely. Again, pain is a funny thing. Sometimes I'm not saying that every time something hurts a little bit, you necessarily have to run into your doctor or see your physio. But generally, give it a day or two. If it's
Mhm.
because we all have odd aches and pains where we lift something and, oh, that didn't feel great, kind of zings. But that's life. Those little things, that was just a one off and it happens once or twice. I wouldn't worry about it. But yeah, there's something that is persisting and nagging, and especially if it's something that's getting in the way of doing things you love. Going back to like with hand arthritis, that if patients where they've stopped doing crafts and stopped doing things they love because, oh, I have arthritis in my hands, I guess I can't do that. That is not okay. There's so many things we could do treatment wise for these. We can treat thumb arthritis. We take through the same treatment as if you have knee arthritis. Like if you go to the doctor and you've got some arthritis in your knee and knee pain, you're usually, start on some medication and given some creams and set up with a brace and set up for physio, maybe cortisone injections. There's a lot of injections we can do for knees, eventually knee replacements. We can do all of those things for thumb and hand away as well. It's exactly the same. And just a lot of people don't know that you got thumb away. There's amazing braces for thumbs, and braces they are not a crutch. They're not a weakness. They actually improve your function, improve your range of motion, improve your strength. So get going in braces so you can keep using your hands. Some specific therapy to restore balance and getting the right muscles working and strengthening. Same medicine, like medical approach, medications, cortisone in conjunction with therapy. But worst case scenario with these thumbs that are really, really bad, there's amazing surgeries for them. There's basically it's kind of the equivalent of a thumb replacement for thumb CMCOA that people have great function. So our hands are super important. So if they're living with pain and they feel that they can't do anything, it is absolutely worth chatting with someone to see if we can make things a little bit better. Um, movement, arthritis of anything, we know from research that movement is one of the best things for arthritic joints. We see that research all the time with knees, but it's the same with any arthritic joint. What's a little more challenging with hands is that often we know, okay, if I have arthritic knee, keep in mind, not a therapist. I am off track a bit, but working with people and keeping on top of research. But, arthritis in the knee, keep moving it, keep bending it, going for walks. Hands, it's not enough to just use your hands if you have arthritis, because I do find that, especially in fingers, that people use them, but they start to collapse their thumbs and they kind of cheat. So it is of benefit to just having someone look at your patterning and maybe give some specific exercises to make sure that when you are moving using your hands, you're using all those joints in their optimum way.
Being more intentional about the movement that you're.
Exactly. Yeah, 100%. Very intentional. And not to be afraid of movement. I don't see this very often, but occasionally see a patient come in and they've been told they have arthritis, so they're not moving their hands. They're afraid to move it. And that's where, again, that education thing is that movement is so important. We want to keep moving those. It's very, very key.
Stacey, I feel like you've given us so much great information today. Some of the things I'm thinking about was the the pain around being normal or not normal. And I think you kind of hit on it, right? You know your body best. And so if the
Yeah,
pain is persisting beyond a couple days and it doesn't feel quite right, something's a little off, it doesn't hurt to go in and get it checked to kind of
absolutely. Yeah,
check those boxes and make sure that it's nothing more serious that you're not aware of. And then
yeah,
I think the other piece too, right? Like with any um I think with any injury, like movement is just so important. But
Yes. Yeah.
it's right. It's like the intentional movement is the right movement, and knowing how to progress through that movement is really so key and so important.
Yeah, and it's, you asked this question, I think anytime if you're wondering, like that's what physio's for. If physio doesn't have to be something where you're significantly injured, you go to physio. That we love seeing people preventatively. Just again, it's that education piece. And generally, every clinic setup and appointment system is a bit different, but generally with physio that we have a little bit more time to spend with you and sort of talk about your goals and what you're working on and what is bothering you, and to unpack that and help guide you, that if you haven't seen a doctor yet and you're telling us or you're showing us some things that are a little concerning, your physio is going to refer you on, right? Often it's it's interesting. I still get asked if you need a referral to see physiotherapy, and it sort of surprises me because I've been doing this for a long time. And when I first graduated 30 years ago, you did. 30 years ago, you needed a referral from your doctor to see a physio, but that hasn't been in place for at least 25 years, if not longer. And you don't, if you're just not sure. And your physio, if they think you should see a doctor for imaging or anything else, they are going to relay you back to your doctor and communicate that. So we're always available for that information. And even if it is just peace of mind to get you going.
Absolutely. And you're talking about like that prevention and just the
Mhm.
education piece. Are there any good public resources available just maybe around basic hand and finger stretches that people could look to incorporate into their day?
There probably is. I think I'm really fussy with my exercises, and so I'm really biased. And so I find when I start looking at things, I pick them apart. But that's me being a bit of a perfectionist. I think, sources like even arthritis websites and pages like that, like your bigger organizations, like Arthritis Society is absolutely going to have some great information as a basis. So yeah, I'm sorry, I should have more of that on tap. I just usually sort of provide it individually, but
Well, and I think that's like a really important message too, right?
yeah,
There is something to be said about individualized treatment and individualized plans because everyone moves a little bit differently.
yeah,
Everyone has some different considerations when it comes to their joints. So I think that's like a really important piece as well, is depending on where you are in your journey,
yeah,
getting that appropriate support from a professional can
yeah.
go a long way to making sure that you're doing what's right for your body.
Absolutely. And again, all movement is good movement. So even if you're finding something online as a starting point to get moving, yes, I say how I'm really fussy, but those are still good, right? It's good to start listening to your body. Don't do any exercises that seem to make you feel worse. We wouldn't give you that either. But sometimes
Absolutely.
just to start with those resources, and then, maybe that's all you needed is just some basic things to get going and you're feeling a bit better. But maybe if those basic things you're struggling with and it's not improving or making you feel worse, maybe that's it, then it's a sign, right? Well, maybe I do need a little more guidance. Doesn't mean you need to go for a lot of therapy, but just to check in with someone once or twice to get a tailored exercise program that sort of suits you a little bit that you can work on in your home.
Well, thank you so much. Like I said earlier, you've provided a wealth of information, and I hope
Thank you.
everyone who's listening today really takes time to think about, ooh, what am I doing for my hand and my wrist health and paying more attention to those very important body parts.
So important. They do lots of great things. They're amazing.
Well, thank you so much, Stacey. I've appreciated the conversation.
Me too. Really enjoyed this. Thank you.
We just had a fantastic conversation with Stacey Will about all things hands and wrists. If you're interested in learning more about physiotherapy or to find a physiotherapist near you, visit albertaphysio.com. See you next time.